Let's step back in time to an era when the thought of going under the knife would send chills down your spine. The world before anesthetics. Imagine, if you will, a time when surgery wasn't so much a calm, sedated experience as it was a terrifying, desperate act of survival. Pain was a given, not an option. The whole idea of being operated on in those days was something out of a horror story. Yet, back then, this was reality. Buckle up, because the past is about to feel very real. And it's not for the faint of heart. Our journey into this unimaginable era begins centuries ago, when, if you had an illness or injury, there were no painkillers, sedatives, or numbing agents to ease you into medical care. Surgery wasn't just scary, it was the last resort. We're talking about the Middle Ages, when medicine was a wild mix of trial, error, and sometimes outright guesswork. If you had an infected tooth, it was yanked out. Broken limb? Braced as best as possible, but don't expect any fancy metal rods or casts. And if you had something serious, like a gangrenous limb, well, brace yourself, because it was getting amputated while you were wide awake. Let's focus on amputation for a second. It was one of the most common surgeries and a true test of both the patient's endurance and the surgeon's skill. Imagine you're lying on a table. A surgeon is gripping a saw, and you know exactly what's about to happen. There's no numbing agent, no countdown to blissful sleep, just a group of assistants or maybe friends holding you down as the blade sinks in. Some patients would faint from shock, which was seen as a kind of accidental anesthetic, because at least it blocked them from feeling the agony. If you managed to stay conscious, you were in for minutes of indescribable pain, often made worse by infection afterward. Infection was a huge issue back then, since sterilization practices were non-existent. Dirty instruments, unwashed hands, all part of the terrifying reality. People back then accepted it as part of life. They believed that, after all, pain was simply part of the human condition, especially if you wanted to stay alive. But humans are inventive. So, they came up with alternatives to dull the pain. Some of these early pain relievers were creative, to say the least. For instance, before anesthetics, alcohol was probably the closest thing you'd get to pain relief. Doctors would give patients liquor to drink, and lots of it, hoping it would dull the senses enough to make surgery bearable. There were other concoctions too, like opium and even mandrake root, a plant with mild sedative properties, though definitely no match for what we have today. These natural substances could numb the pain slightly, but they were unpredictable and far from reliable. Too little and the patient would feel everything. Too much and it could be fatal. It was a delicate, dangerous dance, and it wasn't always effective. For some time, the best-known way to anesthetize a patient wasn't a substance at all. It was speed. Surgeons back then prided themselves on how quickly they could perform an operation. The faster the surgery, the less time the patient would have to suffer. In fact, one of history's most famous surgeons, Robert Liston, was nicknamed the fastest knife in the West End. He could amputate a limb in under 3 minutes. Imagine someone sawing through a bone that quickly. It's a strange twist on the idea of efficiency, isn't it? Yet, for many, speed was the only saving grace in a world where anesthesia didn't exist. And as the centuries rolled on, humans kept searching for better ways to reduce the pain. In the 18th century, some surgeons began experimenting with ways to dull the senses even further. One particularly daring option was mesmerism, or as we know it today, hypnosis. Yes, that's right, some believed that through hypnosis, a patient's mind could be coaxed into ignoring the pain. While it didn't exactly work like a modern anesthetic, some reports suggest that hypnosis did, at times, help patients relax enough to make the experience less traumatic. However, it was far from reliable and never truly took hold as a mainstream option. Then came the early 19th century, a turning point in this saga of suffering. Scientists began experimenting with gases like nitrous oxide laughing gas. A dentist named Horace Wells discovered in 1844 that nitrous oxide could make patients less sensitive to pain. He famously demonstrated its effects by having his own tooth extracted under the influence of laughing gas, showing people that it could indeed work. While nitrous oxide was a groundbreaking discovery, it didn't completely stop the pain. It was the first step, that scientists wanted something even stronger. The game changer, however, arrived in 1846. A man named William T.G. Morton, an American dentist, performed the first public demonstration of ether as an anesthetic in Boston. Ether was revolutionary because it didn't just dull pain, it made patients unconscious. Morton's demonstration was a success, and it was this moment that marked the beginning of modern anesthetics. News of ether spread quickly, and suddenly the medical world was forever changed. For the first time, doctors could operate on patients who wouldn't feel a thing, and they could take their time to do it properly. Ether was soon joined by another powerful anesthetic, chloroform. Chloroform became extremely popular, especially in Britain. Even Queen Victoria famously used chloroform during the birth of her 8th child, bringing it a royal seal of approval. Unlike ether, which was highly flammable and had a pungent smell, chloroform was odorless and easier to administer. Doctors now had two powerful tools to relieve patients' pain and make surgery a more bearable experience. With ether and chloroform, surgery was no longer an exercise in terror. Patients could sleep through their operations, and surgeons could focus more on precision than speed. Of course, these anesthetics were far from perfect. Ether, for example, could cause severe nausea and had a tendency to irritate the lungs. Chloroform, on the other hand, was later found to be toxic to the liver and could even be fatal in some cases. But despite these risks, they transformed medicine. Anesthesia opened the door to more complex surgeries that would have been unimaginable in the past. As we moved into the 20th century, anesthesia became safer and more sophisticated. New drugs were developed, along with better techniques for administering them. Local anesthetics were introduced, allowing doctors to numb specific parts of the body, rather than putting the entire patient to sleep. This allowed for a whole new range of medical procedures. The discovery of intravenous anesthetics, combined with modern monitoring equipment, meant that anesthesia could now be finely tuned to each patient's needs. Today, we have a wide range of anesthetics at our disposal, from local injections to complex cocktails of drugs that ensure patients feel no pain. Anesthesiologists, specialists in this field, are a crucial part of the surgical team, monitoring the patient's vital signs and adjusting dosages to ensure their comfort and safety. It's a far cry from the old days of biting down on a piece of wood or drinking copious amounts of brandy to dull the pain. Reflecting on this evolution gives us a new appreciation for how far we've come. Anesthesia has not only allowed for the development of modern surgery, but has also redefined our understanding of pain and what we can do to avoid it. Today, we can go into a procedure without a second thought about pain, knowing that we'll be in a controlled, comfortable environment. It's amazing to think that just a couple of centuries ago, surgery was a last resort, nightmarish experience. Thanks to the pioneers who braved the unknown, we now have the gift of painless procedures, a cornerstone of modern medicine. So, next time you find yourself on an operating table, or even just at the dentist's, take a moment to be grateful for the invisible miracle of anesthesia. We live in a world where pain relief is a given, but it wasn't always that way. We've come a long way from the terrifying, unyielding world before anesthetics.